Hello, this is Dr. Pete Butkins. This video today is on the benefits of outpatient treatment as regards drug and alcohol, the drug and alcohol problem. And I want to educate you and encourage you that treatment works. This problem is highly treatable. The key to treatment is getting the person who has the problem and the family, the significant others, to agree on the treatment and follow through and follow the lead of people that have worked in this field and who are the experts. Inpatient treatment is needed sometimes. Sometimes the person is highly addictive in chronic stages. They use too much of the drug, the tolerance is built, and they need to detox. If the person is using opiates, Dilaudid, hydrocodone, Oxycontin, any of those opiates, then there is a need to detox. A lot of times with alcohol, the detox is the most dangerous. Alcohol barbiturates, and of course, a lot of the people that have used chronically, no matter what the drug is, detox may be necessary. There's also a need for inpatient if the person needs to get away from the triggers and cues temporarily until they can relocate or find a support system within the community to help them be able to abstain and find 12-step meetings that will help them to maintain recovery. So if the person's in chronic stages, or they need to detox, or the drug of choice is severe enough, they may need inpatient. The cost of inpatient is very high. Outpatient treatment works very successfully, but I do want to caution you, if the person needs to detox, you may want to put the person in temporarily in inpatient treatment. A lot of the residential treatments are 2, 3, 4, 5, 6 months in length at $10,000 to $30,000 a month. I have an outpatient treatment program in Altamont Springs. I have a Department of Children and Families state license to practice intensive outpatient, which is 10 to 30 hours a week, and we do that here at my Freedom Quest. The advantage of outpatient is the person can stay home, they can work, they can go to school, they can stay in the mainstream of society where the triggers are and learn to cope with the triggers as they stay in treatment. Again, the key component is the family. The family must learn about this addiction, go to their 12-step meetings, look at this as a family disease, and learn about codependency and enabling, and learn to detach with love and give the person a chance to get sober by not depriving them of the pain and loss it takes to get sober. The consequences have to be enforced, or the person will not get sober. The drug is too powerful for the person to think straight and be logical and detach from the toxic system that they've been involved in with the family and with their other enablers without some type of treatment. The Dr. Drew Pinsky advocates 3 years in treatment. Now, I'm not sure 3 years is necessary. I think it needs to be individualized, but I think a year in an IOP, if the drug of choice is opiates, crack, crystal meth, or there's a severe alcohol problem, I think that's safe. The cost is 1/12 of what you'll spend on inpatient treatment as a rule. My treatment program will cost you about $1,500 a month, as opposed to a year's treatment at $30,000 a month, or $10,000, or $20,000. So it's very cost effective, and this is the rainy day. This is what you save the money for. So I want to create the value and let you know that you want to pay for treatment. The cost with my Freedom Quest is really minimal compared to the cost of the disease, the DUIs, the judge, the lawyers, the cars that are wrecked. And you can't put a price tag on the emotional pain and the relationships that are broken, and the idea that parents lose their children, children lose their parents, spouses lose their spouse. Eventually no one's in there anymore. So if you're watching this video because someone you love or you are in dire straits because of addiction, strike while the iron's hot. Be very cautious to follow the advice of people that have been there for years and have taken care of this problem and really know what to do. again, the key is to follow the direction of someone who really knows what they're doing in this field, and someone who you can trust. The best way to get a treatment provider is word of mouth, someone who's been to that treatment program and is sober 2, 3, 4, 5 years, or their significant other is, or son, child is sober and clean for a while. So I hope this video has been helpful. I'm doing it mainly because I now have an intensive outpatient treatment program. I also have a treatment program that's non-intensive. You can go once or twice a week. It depends on the treatment plan. It depends on what kind of evaluation we've done. So again, this is a rainy day you've been saving for. There's nothing better you can spend your money on. And our number at Freedom Quest is 407-786-1913. The website is myfreedomquest.com, and you can call me, Dr. Pete Butkins, anytime, and we'll get back to you real quick and get you in for an evaluation. Thank you very much for listening, and God bless.